everyone, it's Dr. Clint Steele. I'm proud to present Chiropractic for Docs, and I'm here today with Kai Haselmeyer from Germany. How are you this morning, Kai?
I'm fine, Clint. Thank you.
Awesome. Thanks so much for being with me. A couple things I want to share with the audience real quick. You are a chiropractor in practice, but in addition, you're the research director for a chiropractic university in Germany, correct?
That's right, yeah.
Okay. So I want to talk to you about some of that research, some of the stuff that we're coming up with right now in regards to true chiropractic, what DD and BJ said over 100 years ago, and now the research is starting to try to back it up almost. But so many of the profession have kind of gone off to, you know, the neck and low back pain type thing, but that's not what true chiropractic is really about. Agreed, Kai?
Absolutely, and the problem is actually it's not even just the problem that it's not what chiropractic is about. It's actually not even scientific. All the research community is pretty much in the last couple of decades proving more and more and more what we actually knew all along, and what most chiropractic students actually don't learn anymore, so they don't know it. Which to me causes the major problem and the struggle that so many chiropractors have actually. In Germany, we're not many chiropractors. We are a small group. So competition is not that much and things are a little bit easier. But whenever I travel to the States, which I do very frequently, and I see all those chiropractic offices that pretty much look like cheap rundown massage places, and I see all these desperate people trying to do all sorts of strange things to get patients into the office because they just have no idea what they are really offering, and they have no idea how to communicate it. And,
exactly.
It's a huge problem.
Yeah, so that's what this whole program is about, so I appreciate you being on here. I want to get in real quick to, you made a post on Facebook that really got me excited, and you talked a little bit about pathogenesis, you know, which a lot of chiropractors are going that route right now, as well as obviously the medical profession, compared to salutogenesis. Can you just describe kind of the difference a little bit and kind of where chiropractic should stand in that philosophy?
Well, salutogenesis is a term that Antonovsky he termed that in the 70s, and it's pretty interesting because he was actually doing research on Holocaust survivors. And what he found is, strangely, that some of these people who went through these horrors of the Holocaust who survived, they were actually thriving, and they were healthy and happy and living wonderful lives. And that was strange to him, because he thought that somebody who went through this torture in a physical and in a psychological sense shouldn't be thriving like that. Right. And some of these people got really old and had happy, wonderful lives. And so he started his research asking a very intelligent question, which was, what is different about these people that makes them healthier and happier and makes them thrive? So he asked a positive question about health. And if you read D.D. Palmer, that's pretty much the same question that he asked. He was talking about two brothers sitting on the same table, one getting sick, the other not getting sick, but he didn't ask what is wrong with the guy who got sick. Right. He asked what is different with the guy who stays healthy. And so that's a similar question. So salutogenesis is pretty much looking at what makes people healthier, what can enhance health proactively, looking at the end product, health, and then looking at a way to enhance it. And yeah, that's pretty much it.
Yeah, I think the quote is something like, you know, medicine is what the study of what causes man to die, while chiropractic is what causes man to live.
Yeah, that's what.
And that's where so that's where chiropractic should be, right? I mean, we're right there, but yet so many chiropractors are turning they're going down the pathogenic route, you know, as to, you know, trying to it's just a total reversal of what it should be and what DD and BJ meant it to be. Can you talk a little bit about where chiropractic should be in this whole process?
Yeah, I mean, the interesting thing is all the research is showing it comes from psychiatry and from all different kinds of research perspectives that if you just fight a negative state And even if you manage to get rid of a negative state, you have not necessarily increased a positive state.
Right.
If you help a patient to get out of depression, the result is not a happy patient.
Right.
You might have somebody who is not depressed anymore, but that
Right.
doesn't make him happy. So there's really a difference of getting somebody out of an acute crisis or making somebody healthy. And in the end, there are so many health professions in the world who are actually doing a great job on working on crisis intervention. And that's
Absolutely.
actually, I think medicine could do a lot better in many fields, or they could stay out of many fields, but in their main competence area, crisis intervention, medical doctors are doing an awesome job. And we should be very happy that they're doing that. But we already have them. We don't need more guys who are doing that.
Exactly.
And chiropractic is pretty much the only profession, if you really take a close look at it, who had a salutogenic approach pretty much from the beginning on. And it was about enhancing health and looking at what can make people function better. And even if you look at all those things like homeopathy or traditional Chinese medicine, those are soft approaches, holistic approaches, but it is still about treating something.
Right,
Even
right.
if you're a homeopath, you look at a symptom, you look at it at a much deeper level than allopathy. But it is still about what can I do to alter something to treat the disease. It's not about what can I do to enhance health. And we're pretty much, I mean, correct me if you can think of anything else, but even if I look at traditional Chinese medicine, all those things, it is all pathogenetic approaches. And even the research community asked for more salutogenesis. Yeah. And it makes sense, because if I enhance health, I don't have to deal with disease except in acute crisis. If I get run over by a fire truck, I need a good MD to put me back together. I don't need a chiropractor. But hopefully that is something that doesn't happen too often. And we are the only guys who have the philosophy and actually have the competence from the beginning on to be the profession that is at the forefront of enhancing health and enhancing well-being and giving people the opportunity to just make use of the potential that they should actually have from the beginning on.
Yeah. So we're there. I mean, we're there. We just got to embrace it, and we gotta move with it. And we got to educate. What I find in my practice, and what a lot of true chiropractors do, you know, the American society, especially, they're in this, you know, I have a symptom, I'm going to go get it taken care of type mentality, and that's what we're talking about, the pathogenic. And so that gets them in the office, absolutely. But then you educate them. You say, listen, there's so much more to chiropractic than just taking care of this symptom. And that's when you have them in here and you have them, you know, educated. And what we're doing with True Chiropractic is to educate people so that they can live healthier lives. They can live their true potential. I appreciate it, Kai. I'm sorry, go ahead.
Oh, I was just saying, in the beginning, that's not the easy way, because you really have to talk to people. If you just stay in the pathogenesis model, it's easier, because you just pick them up where they're at, and then you wreck them cracking, and the back pain is gone, and then you get somebody new in. That's not the way I would like to work, but it takes bravery to tell a different story. But if you tell it, they want it, they understand it. It makes so much more sense.
That's exactly. You tell the story, tell the chiropractic story. So many people that I tell the chiropractic story to, they look at me. I mean, I'm talking nurses, I'm talking, you know, massage therapists, I'm talking, you know, medical professionals that look at me and say, holy cow, that makes so much sense. Why wasn't this ever explained to me before? And then chiropractors are the ones that need to explain it. So anyway, we're preaching to the choir. I just wanted to get you on here, share a little bit more. Kai, thank you so much for being with us this morning. I appreciate it.
Thank you for having me.
Have a great day.